Welcome to today's full fluid and electrolyte NCLEX mastery session. If you are preparing for the NCLEX or any nursing exam, this is one topic you must understand with absolute clarity because fluid and electrolyte questions are high-yield, tricky, and appear in every exam setting. In this lesson, you will practice 50 well-structured questions with answers, rationales, and strategies that focus on deep understanding, not memorization. Each question is specifically designed to train your clinical judgment, sharpen your test-taking skills, and help you avoid the common mistakes many candidates make. Stay with me till the end so you don't miss the critical reasoning patterns that can help you score higher and pass confidently. Let's begin. Question 1. A client with persistent vomiting is at risk for which acid-base imbalance? A. Metabolic acidosis. B. Respiratory alkalosis. C. Metabolic alkalosis. D. Respiratory acidosis. Correct answer, C. Metabolic alkalosis. Rationale. Vomiting causes loss of hydrochloric acid, leading to metabolic alkalosis. Strategy. Think, vomiting equals losing acid alkalosis. Question 2. A client receiving 3% hypertonic saline begins to complain of headache and confusion. What is the priority action? A. Increase the infusion rate. B. Stop the infusion. C. Check blood glucose. D. Encourage oral fluids. Correct answer, B. Stop the infusion. Rationale. Hypertonic saline can cause rapid sodium shifts. Neurological symptoms stop immediately. Strategy. New neurochanges plus hypertonic saline equals stop. Question 3. A client with severe dehydration is expected to have which clinical manifestation? A. Bounding pulses. B. Low urine-specific gravity. C. Decreased BP. D. Crackles in lungs. Correct answer, C. Decreased BP. Rationale. Low fluid volume leads to reduced circulating volume hypotension. Strategy. Fluid deficit equals BP, HR. Question 4. Which client is at highest risk for hyperkalemia? A. Client taking loop diuretics. B. Client with NG suction. C. Client with acute kidney injury. D. Client with diarrhea. Correct answer, C. Client with acute kidney injury. Rationale. Potassium is excreted by the kidneys, impaired renal function K plus retention. Strategy. Kidneys failing equals potassium rises. Question 5. A client with hyponatremia reports headache and confusion. What is the priority? A. Restrict fluids. B. Monitor intake and output. C. Give sodium tablets. D. Prepare for seizure precautions. Correct answer, D. Prepare for seizure precautions. Rationale. Severe hyponatremia swelling of brain cells risk for seizures. Strategy. Any neurochanges in hyponatremia seizure precautions first. Question 6. Which finding indicates fluid volume overload? A. Weight loss. B. Sunken eyes. C. S3 heart sound. D. Dry mucous membranes. Correct answer, C. S3 heart sound. Rationale. S3 indicates excess fluid and heart failure. Strategy. Think, extra fluid extra heart sound. Question 7. A client on furosemide reports muscle weakness. What electrolyte is most likely low? A. Sodium. B. Potassium. C. Calcium. D. Phosphate. Correct answer, B. Potassium. Rationale. Loop diuretics increase potassium excretion. Hypokalemia symptoms, weakness, cramps. Strategy. Furosemide equals K plus falls. Question 8. A client with hypocalcemia may exhibit which sign? A. Negative Chvostek sign. B. Flaccid muscles. C. Tingling around the mouth. D. Decreased reflexes. Correct answer, C. Tingling around the mouth. Rationale. Hypocalcemia causes neuromuscular excitability, paresthesia. Strategy. Tingling plus twitching equals low calcium. Question 9. Which ABG result indicates metabolic acidosis? A. pH 7.50, HCO 330. B. pH 7.30, HCO 318. C. pH 7.48, CO 228. D. pH 7.32, CO 255. Correct answer, B. pH 7.30, HCO 318. Rationale. Low pH plus low bicarbonate equals metabolic acidosis. Strategy. Match pH with bicarbonate for metabolic. Question 10. Which food should the nurse recommend for a client with hypokalemia? A. Apple. B. Banana. C. Lettuce. D. Rice. Correct answer, B. Banana. Rationale. Bananas are potassium-rich. Strategy. Think, bananas, oranges, potatoes equals K plus dot. Question 11. A client receiving insulin therapy is at risk for which electrolyte imbalance? A. Hypernatremia. B. Hypokalemia. C. Hypercalcemia. D. Hypermagnesemia. Correct answer, B. Hypokalemia. Rationale. Insulin drives K plus into the cell's lower serum potassium. Strategy. Insulin equals potassium shift into cells. Question 12. A client in DKA is being treated with 4 fluids and insulin. Which electrolyte needs the closest monitoring? A. Sodium. B. Chloride. C. Potassium. D. Calcium. Correct answer, C. Potassium. Rationale. As acidosis resolves and insulin is administered, potassium rapidly shifts into cells' hypokalemia risk. Strategy. DKA correction equals potassium will drop. Question 13. Which symptom indicates hypernatremia? A. Confusion. B. Hypotension. C. Abdominal cramping. D. Tetany. Correct answer, A. Confusion. Rationale. High sodium shrinks brain cells' neurological symptoms. Strategy. Sodium imbalance think brain changes. Question 14. A client with edema and ascites likely has which abnormal lab value? A. High albumin. B. Low albumin. C. High potassium. D. High phosphate. Correct answer, B. Low albumin. Rationale. Low albumin reduces oncotic pressure, fluid leaks into tissues. Strategy. Low protein equals fluid shifts out. Question 15. Which finding is consistent with hyperkalemia? A. Weak, thready pulse. B. Tall peaked T waves. C. Decreased bowel sounds. D. Polyuria. Correct answer, B. Tall peaked T waves. Rationale. Classic ECG change of hyperkalemia. Strategy. Always check ECG when potassium is high. Question 16. A client with NG suction is at risk for which imbalance? A. Hyperkalemia. B. Hypercalcemia. C. Metabolic alkalosis. D. Respiratory alkalosis. Correct answer, C. Metabolic alkalosis. Rationale. NG suction removes stomach acid alkalosis. Strategy. Loss of acid equals alkalosis. Question 17. Which fluid is appropriate for a client with dehydration and hypotension? A. D5W. B. 0.9% NS. C. 0.45%. D. D5 1/2 NS. Correct answer, B. 0.9% NS. Rationale. Normal saline expands intravascular volume. Strategy. Hypotension isotonic fluids. Question 18. Which sign indicates hypomagnesemia? A. Depressed reflexes. B. Bradycardia. C. Hyperreflexia. D. Facial flushing. Correct answer, C. Hyperreflexia. Rationale. Low magnesium increases neuromuscular excitability. Strategy. Low Mg acts like low Ca. Question 19. Which electrolyte imbalance is common in clients with alcoholism? A. Hypermagnesemia. B. Hypomagnesemia. C. Hyperkalemia. D. Hypercalcemia. Correct answer, B. Hypomagnesemia. Rationale. Poor intake plus renal wasting low magnesium. Strategy. Alcohol equals low magnesium. Question 20. A client with hypercalcemia may exhibit which symptom? A. Positive Trousseau sign. B. Muscle twitching. C. Constipation. D. Tremors. Correct answer, C. Constipation. Rationale. High calcium decreases neuromuscular activity constipation. Strategy. High Ca equals slow and calm. Question 21. A client with heart failure is receiving 4 fluids at 150 milliliters per hour. Which finding requires immediate intervention? A. Peripheral edema. B. Urine output 40 milliliters per hour. C. Fine crackles in the lungs. D. Warm extremities. Correct answer, C. Fine crackles in the lungs. Rationale. Crackles indicate pulmonary edema from fluid overload. Strategy. HF plus crackles equals stop fluids and assess. Question 22. Which lab result indicates dehydration? A. Hematocrit 28%. B. Sodium 130. C. Urine specific gravity 1.035. D. Potassium 3.0. Correct answer, C. Urine specific gravity 1.035. Rationale. High specific gravity means concentrated urine due to low fluid volume. Strategy. Higher number equals more concentrated. Question 23. A client receiving 4 potassium reports burning at the 4 site. What should the nurse do first? A. Stop the infusion. B. Decrease the rate. C. Check for infiltration. D. Flush the line. Correct answer, B. Decrease the rate. Rationale. Potassium is irritating, slowing the rate reduces discomfort. Strategy. Pain with K plus slow the rate. Question 24. Which symptom is associated with hypophosphatemia? A. Muscle weakness. B. Hyperreflexia. C. Tetany. D. Diarrhea. Correct answer, A. Muscle weakness. Rationale. Low phosphate reduces energy, ATP, weakness. Strategy. Phosphate equals energy. Question 25. A client on lithium therapy is most at risk for toxicity when experiencing A. Hyperkalemia. B. Hyponatremia. C. Hypernatremia. D. Hypocalcemia. Correct answer, B. Hyponatremia. Rationale. Low sodium increases lithium reabsorption toxicity. Strategy. Low Na equals lithium rises. Question 26. Which order should the nurse question for a client with hyperkalemia? A. Furosemide. B. Sodium polystyrene. C. Potassium chloride 4. D. Insulin with glucose. Correct answer, C. Potassium chloride 4. Rationale. Hyperkalemia never give additional potassium. Strategy. High K equals NOK given. Question 27. A client has Trousseau's sign. What electrolyte imbalance is suspected? A. Hypercalcemia. B. Hypocalcemia. C. Hypernatremia. D. Hypermagnesemia. Correct answer, B. Hypocalcemia. Rationale. Trousseau's sign is classic for low calcium. Strategy. Twitching equals low Ca. Question 28. A client with metabolic acidosis is compensating by A. Slowed respirations. B. Rapid breathing. C. Shallow respirations. D. Breathing irregularly. Correct answer, B. Rapid breathing. Rationale. Kussmaul respirations blow off CO2 to raise pH. Strategy. Acidosis body breathes fast. Question 29. A client has serum sodium of 128. Which intervention is expected? A. Prepare for sodium restriction. B. Encourage water intake. C. Initiate seizure precautions. D. Administer hypotonic fluids. Correct answer, C. Initiate seizure precautions. Rationale. Severe hyponatremia increases seizure risk. Strategy. Low Na equals protect the brain. Question 30. The nurse should monitor for which sign in a client with hypokalemia? A. Tall T waves. B. Increased GI motility. C. Muscle cramps. D. Bradycardia. Correct answer, C. Muscle cramps. Rationale. Low potassium muscle irritability and cramping. Strategy. Low K equals slow, weak muscles. Question 31. Which fluid is appropriate for a client with hypernatremia? A. 3% saline. B. D5W. C. Lactated ringers. D. 0.9% NS. Correct answer, B. D5W. Rationale. D5W becomes free water dilutes sodium. Strategy. High Na equals give free water solutions. Question 32. A client with low magnesium is at risk for which complication? A. Seizures. B. Bradycardia. C. Respiratory depression. D. Paralysis. Correct answer, A. Seizures. Rationale. Hypomagnesemia increases neuromuscular excitability seizures. Strategy. Low Mg behaves like low Ca. Question 33. A client receiving blood transfusion begins to wheeze. What should the nurse do first? A. Check vital signs. B. Slow the transfusion. C. Stop the transfusion. D. Give diphenhydramine. Correct answer, C. Stop the transfusion. Rationale. Wheezing anaphylactic reaction stop immediately. Strategy. Transfusion reaction equals stop first. Question 34. Which symptom indicates fluid volume deficit? A. Distended neck veins. B. Cool, clammy skin. C. S3 heart sound. D. Lowered hemoglobin/HCT. Correct answer, B. Cool, clammy skin. Rationale. Low fluid poor perfusion cool skin. Strategy. Shock-like signs equals fluid deficit. Question 35. A client with hypercalcemia is most at risk for A. Diarrhea. B. Muscle twitching. C. Kidney stones. D. Tetany. Correct answer, C. Kidney stones. Rationale. High calcium precipitates into stones. Strategy. High Ca hard stones. Question 36. Which order should be clarified for a client with renal failure? A. Furosemide. B. Potassium supplement. C. Fluid restriction. D. Erythropoietin therapy. Correct answer, B. Potassium supplement. Rationale. Kidneys cannot excrete potassium, supplements risk dangerous hyperkalemia. Strategy. Renal failure equals avoid potassium. Question 37. Which sign indicates metabolic alkalosis? A. Kussmaul respirations. B. Slow, shallow breathing. C. Hyperkalemia. D. Warm skin. Correct answer, B. Slow, shallow breathing. Rationale. Body retains CO2 to compensate for alkalosis. Strategy. Alkalosis equals body hypoventilates. Question 38. Which finding indicates hyperphosphatemia? A. Constipation. B. Weak pulses. C. Positive Chvostek sign. D. Hyporeflexia. Correct answer, C. Positive Chvostek sign. Rationale. High phosphate lowers calcium neuromuscular excitability. Strategy. Phosphate high equals calcium low. Question 39. A client with SIAD will have which lab finding? A. High urine sodium. B. Low urine osmolality. C. Elevated hematocrit. D. High serum sodium. Correct answer, A. High urine sodium. Rationale. SIAD concentrated urine with high sodium. Strategy. SIAD equals soaked inside. Question 40. A client has potassium level 2.7. What should the nurse do first? A. Administer oral potassium. B. Place on cardiac monitor. C. Encourage bananas. D. Recheck potassium. Correct answer, B. Place on cardiac monitor. Rationale. Potassium less than 3.0 is dangerous dysrhythmias. Strategy. Low K kills the heart monitor first. Question 41. A client with severe burns is at risk for which electrolyte imbalance? A. Hyperkalemia. B. Hypercalcemia. C. Hyponatremia. D. Hypokalemia. Correct answer, A. Hyperkalemia. Rationale. Burns cause massive cell destruction K+ released. Strategy. Cell injury equals potassium rises. Question 42. Which ABG result indicates respiratory alkalosis? A. pH 7.30, CO2 55. B. pH 7.48, CO2 30. C. pH 7.20, HCO3 16. D. pH 7.52, HCO3 34. Correct answer, B. pH 7.48, CO2 30. Rationale. High pH plus low CO2 equals respiratory alkalosis. Strategy. CO2 and pH move opposite in respiratory issues. Question 43. Which finding suggests overhydration? A. Increased hematocrit. B. Decreased weight. C. Bounding pulse. D. Dry skin. Correct answer, C. Bounding pulse. Rationale. Fluid overload increases circulatory volume. Strategy. More fluid equals stronger pulses. Question 44. A client with hypermagnesemia may exhibit A. Hyperreflexia. B. Seizures. C. Depressed reflexes. D. Tremors. Correct answer, C. Depressed reflexes. Rationale. High magnesium suppresses neuromuscular activity. Strategy. High Mg equals everything slows. Question 45. A client on potassium-sparing diuretics should avoid A. Spinach. B. Rice. C. Apples. D. Bread. Correct answer, A. Spinach. Rationale. Spinach is high in potassium, risk hyperkalemia. Strategy. Spironolactone equals avoid K-rich foods. Question 46. Which electrolyte imbalance is seen in clients with pancreatitis? A. Hypercalcemia. B. Hypocalcemia. C. Hypernatremia. D. Hypermagnesemia. Correct answer, B. Hypocalcemia. Rationale. Fat necrosis binds calcium, reduces serum levels. Strategy. Pancreatitis equals low calcium. Question 47. A dehydrated client is receiving isotonic fluids. Which outcome indicates effective therapy? A. Increased weight. B. Decreased BP. C. Elevated urine-specific gravity. D. Weak pulse. Correct answer, A. Increased weight. Rationale. Weight gain reflects restored fluid volume. Strategy. Daily weight equals best indicator. Question 48. Which finding is expected in respiratory acidosis? A. Hypokalemia. B. Confusion. C. Tachypnea. D. Tetany. Correct answer, B. Confusion. Rationale. CO2 retention depresses CNS confusion. Strategy. High CO2 affects the brain first. Question 49. A client with diarrhea is at risk for which electrolyte imbalance? A. Hypercalcemia. B. Hyperkalemia. C. Hypokalemia. D. Hypermagnesemia. Correct answer, C. Hypokalemia. Rationale. Lower GI losses contain potassium hypokalemia. Strategy. Diarrhea equals lost K. Question 50. A client with low sodium should avoid which intervention? A. Seizure precautions. B. Hypertonic saline. C. Rapid correction. D. Restrict fluids. Correct answer, C. Rapid correction. Rationale. Raising sodium too quickly can cause brain damage, central pontine myelinolysis. Strategy. Na must rise slowly. Well done for completing all 50 fluid and electrolyte NCLEX questions. If you reached this point, you have strengthened your understanding of one of the most important topics in nursing practice. Remember, consistent practice with high-quality questions like these is what builds confidence, accuracy, and speed on the NCLEX. Make sure you review your weak areas, revisit the rationales, and continue practicing similar topics to reinforce your clinical judgment. If you found this helpful, share it with someone preparing for their exam and let me know how many questions you got right. Keep going, you are much closer to passing your exam than you think.